By the end of this video, you will know how to answer NBME type questions related to the transfusion reactions. If you'd like to receive a weekly free summary to review before your rounds or before your Step 2 CK exam, send an email to the address in the description. The first transfusion reaction is the allergic reaction. This type of reaction is a type 1 hypersensitivity reaction. It is caused by donor proteins from plasma that attach to the IgEs of the basophils or mast cells of the recipient. This is more commonly seen in patients that receive regular transfusions. It is a type 1 hypersensitivity reaction. The presentation of the patient is with flushing, urticaria, fever, and wheezing. The treatment, the first line treatment, is represented by antihistamines, followed by epinephrine if it is severe. A severe allergic reaction can develop into the second type of blood transfusion reaction, namely the anaphylactic shock. The anaphylactic shock is a type 1 hypersensitivity reaction. It is caused by degranulation of mast cells and basophils with release of histamines. The amount of the released histamine is the difference between the allergic reaction and the anaphylactic shock. Namely, in the anaphylactic shock there is an extremely high amount of histamine released. However, not only that donor plasma proteins can cause anaphylactic shock as in the allergic reactions, but also IgAs. This type of anaphylactic shock is seen in patients that have an IgA deficiency. The presentation of the patient at the emergency room includes hypertension, an increase in heart rate, and respiratory arrest. The best initial step required on the NBME questions is represented by stopping the transfusion. The best next step required for NBME questions after the transfusion stop is administering epinephrine. Next week we will have another live stream with NBME type questions. Vote the topic of the next Step 2 CK course with the link in the description below. With the hope that you didn't fall asleep, we will take a short break before going to the last two types of transfusion reactions. The third blood transfusion reaction is represented by febrile non-hemolytic reaction. In this case, the blood bags that have been stored for a long time will amount an increased quantity of cytokines. In turn, these cytokines will activate neutrophils of the recipient. The presentation of a patient with non-hemolytic febrile reaction includes chills, fever, and headache. However, this reaction has to occur in 1 to 6 hours from the transfusion. The treatment for febrile non-hemolytic reaction is usually acetaminophen. However, on NBME questions we can be asked how can we prevent this type of reaction. The answer is represented by leukoreduction, thus eliminating the cytokines from the stored blood bags. The last transfusion reaction is the most severe. It is a type 2 hypersensitivity reaction. It is named hemolytic transfusion reaction. The hemolytic transfusion reaction can be caused by preformed antibodies in the case of an AB0 hemolytic transfusion reaction, or it can be caused by formed antibodies in the case of minor blood groups. For the minor blood groups and the formed antibodies, there is a delay in the reaction's appearance. On the other hand, for the AB0 incompatibility, the reaction is immediate. The mechanism is represented by donor's red blood cells containing, for example, the A antigen reacting with the antibody of the recipient against antigen A. In the aforementioned case, we have a blood type A of the donor and a B type for the recipient. The presentation varies but includes burning at the IV sites, fever. With intravascular hemolysis, hemoglobinuria will occur. With extravascular hemolysis, the patient will be jaundiced. Due to an increased hemolysis, the patient may present with hypotension. Finally, he will have flank pain followed by renal failure. The best initial step to take in such a case is halting the transfusion. If we are asked what is the best next step after stopping it, then the correct answer is represented by IV fluids. Lastly, if the question asks what is the most important component after administering IV fluids, then we have to ensure the renal function. If you liked this USMLE related content, click the subscribe button below.